Being a patient is not a pleasant experience, and unfortunately, I had to visit the emergency room quite a few times when I was in crisis, and some of those times I was taken in by force. The worst part is being put in the isolation room with a security guard outside. It's like being in jail. The psych rooms I've been in, they're just four walls, a door. If there's a window, there's a barbed wire on the window. There's just a bed, like a really, really hard bed. The floors are really dirty. I think the worst part is having the security guard outside, and when I need to use the washroom, or you have to ask permission to go to a washroom. It's like I'm not in jail. And when I do get anybody coming in, it's like, oh no, like I'm not screaming, I'm not yelling. It's like, what are you doing here? You're not really in crisis. You're wasting medical dollars being here. But it's just really disappointing going in there and them not understanding the condition I'm in. They're not able to sympathize with me, or it's not just even sympathizing. It's just a plain understanding of where I am and how much pain I'm in, and not giving me the help that I need. I can't take in advice. I can't listen to you to say, use your mindfulness skills. I'm not capable of doing it. So because I'm not capable of doing what they ask me, I'm being seen as manipulative, treatment resistant, really defiant, and most of all, a really difficult patient to work with. They tell me to control myself all the time. I'm in a lot of pain. I'm in crisis. When I spoke to my therapist, the way she described it was telling a patient to how to live their life when they're having a heart attack at the moment. So the heart attack patient is having a heart attack, but you're telling them, well, you should be exercising, or you should be eating the right foods. So that's how it felt when I was a patient. Like, I'm in pain, so don't tell me to control myself. If I could do that, I wouldn't have gone to seek help. A lot of time it was very dismissive, like, why are you feeling that way? I can't help it. It's just there. In one example, I went into the ER room, and majority of the time it was very dismissive, very, just throw her in, get her into a gown, and then they walk away. I had this wonderful nurse at the Rocky View Hospital. She sat down with me, she held my hand, and she just let me talk, and then she let me cry, and she just knew what to say to me at the right time. What really stood out was she asked me if I was hungry, and I told her yes. And she brought me, it's just a sandwich tray, but she really pampered me in a sense that she opened up the tray, she poured my drink, and I felt like somebody heard me, somebody cared. And I felt so much better after she did that, until the psych resident came in and it went downhill again. I've read a lot of the research articles. I've been doing a lot of research, reading articles from across all, not just psychiatric articles or from the Psychological Association, or just basically like nursing, anything that's related to my disorder, as well as in particular how they describe difficult patients. It's all very negative. It's like it's the patient's fault. You just need to take control and, hold them and just shake them back into stability. That's not how it works. If I could, I would have done that myself. I don't need somebody to tell me what I need to do. I already know what I need to do. It's just whether I can do it or not. You can't take it literally in terms of what they publish in the papers, what's in the textbook, how they teach you in the classroom. That's not, we're real people. We're not textbook cases. Everybody, all mental health patients are unique. And, but we all need some compassion, some sympathy, somebody to help us when we're in that state. And it's not the sympathy whether you go there, it's gonna be okay. We know it's gonna be okay. We just need help de-escalating the pain.